Welcome to online teaching of Dr. Shashikant, myself. Today we are going to discuss about an important medical and yogic concept. I say it's an integrated medicine. Integrated medicine is the newest concept in medical history because most of modern medical science concentrates on a physical body in the form of medicines and surgery. But complexity of modern day lifestyle disease is as such that emotional component and spirit component or energy component is much more important in causing disease. So yoga also believes that mind or emotions are the causative factors of physical bodily diseases. So the similar way, mind body medicine is the newest field of medicine which concentrates mainly of the diseases originated from the mind and percolating into the body. So there is a statistical information saying that 70% of primary physicians or primary doctors' visits are one or other way related to stress. It's very interesting factor when I say 70% of all the diseases where the patient goes to a doctor first are one or other way related to disease, related to stress. For example, back pain, stomach issues, constipation, indigestion, excessive gas, bloating of abdomen, headache, neck pains, shoulder pains, wrist pains, muscle cramps, hypertension, diabetes, anxieties, depressions, and so on and so forth. So most of them, they say disease starts in the mind. There is a chemical change, there is a neurological, neuropeptide changes in the mind which results in increase in our sympathetic stimulation, which means your adrenaline keeps on pumping more. Your adrenal glands, which are situated just on the kidneys, they keep on secreting stress hormones. So these stress hormones, if it is a short term response, it is a survival response in animals, but unfortunately in humans it has become a curse into the modern way of living, because excess of stress hormones induces excess of bodily reactions in such a way that it will induce physical problems. I'll discuss a little about integrated medicine now. So as I already said, stress can cause so many diseases. So modern doctors' interest towards disease is taking a new dimension. This is a dimension of integrated medicine, where we don't just concentrate on just prescribing medicine or just prescribing surgery for that particular disease if it is required. We see three different aspects of the person's body, person's mind, and person's spirit, and the community support. So when I say community, it depends. Indian people medical treatment depends, it's different. Chinese people medical therapies, it's different, because community acceptance is different. So Chinese people, they accept more of self-healing or traditional Chinese medicine rather than just allopathy medicine. So in this way they say, rather than subdividing all the fields of medicine into separate categories, let us integrate into one, which is best for that particular patient, give it that. So that concept is called as integrative medicine, in which we concentrate on four aspects of a being: person, body, mind, and his soul or spirit, and his surroundings, maybe his families, maybe his friends, maybe his support system, maybe his community. After saying this initial concept, Here I mean patient healthcare needs, I mean here the people who are suffering from disease already. And it also means that people who are not having diseases also can take help of this integrative medicine, because there is a preventive medicine already into this. Just highlight few of these components of this complex integrated medicine, which varies or which differentiates or which differs from each country to country. So that's why I mentioned here complex. It's very complex. So this is a need of modern medical doctors to understand what best I can use to help my patients in a way that patients will feel better, not just with the medicines. Medicines already we give. Medicines all the doctors will give. Surgery, all the surgeons will do the surgery. What extra you are giving to that particular person or a patient who is emotional complex being? We are treating disease in the form of disease, but the personality is there. The person who is having disease is different from just a disease and medicines. So other components are involved. So out of that main component we say it's a nutrition. Say for example, there is a diabetic person whose blood sugar goes on varying with his diet, even though he is taking medicines or insulin. What might be the cause of this particular variation in his or her blood sugar levels? Maybe he is not taking care much of nutrition. So concentrating on the nutrition part of the patient is also very essential as that of giving medicines. So we'll just run few of these things. Cultural understanding of the disease. Say for example, few of the diseases like leprosy. In Indian concept they say leprosy, it happened to me because of my some sins in the past. So that dimension or that mindset need to be changed. How you can change? Only when you know what the patient inside, then only you can work on. So nutrition, cultural background, of course medicines you are already giving, and preventability. Even though there is a disease, can you prevent causation of increased blood sugar? Say for example, can you do something wherein patient can take care of his own blood sugar levels optimally? So that is the preventive part. Here you can include exercise, yoga, walking, all the exercise, whatever exercise you can prescribe to the patients, you can include in this preventive medicines. In this preventive medicine, you also include the knowledge of the disease. The patient having that particular disease, the knowledge with which patient understand his or her own disease also very important for you to treat the patient well. When the patient's insight is good, patient's understanding is good, he can take care of himself well along with your medicines. As I already said, mind and body and energy systems are also very important for the person to get healed. So energy systems, you can say Tai Chi or pranic healing or pranayamas or meditation techniques which increases the vital capacity of that particular patient. So these things also very essential. When you practice some of the subtle energy practices, there is a change in your neurotransmitters, and that particular good neurotransmitter can modulate or modify your body in such a way that your healing responses will get activated and body can get healed fast along with your medicines. So mind body component and energy component, these things we'll study in detail when we go further. Surgery, when there is essential for surgery, they'll consider for surgery, otherwise no need. Manual medicines like massage therapies, acupuncture, acupressure also add on, I'll say add on treatments. When I say add on, it means that you are taking modern medical treatments, adding on to that you are doing other forms of therapies so that it can help the person better. Here comes your TCM, traditional Chinese medicine. Herbal or botanical medicines or plants sources or herbal sources which can directly or indirectly it will help in the patient's recovery. And all these components which I talked must be based on some form of research. So that's why I say evidence based. What I'm talking here, it's not just some fancy stuff. When some fancy stuff coming out of my mind I am speaking. It's not that. All this entire concept is devised based on some form of research, some form of evidences done by previous workers or doctors researchers who have done research already, and they have devised this particular concept. My part is, I am understanding these concepts with my intellectual knowledge and applying it with my patients. So this is my way of treating the patients. This is very brief about integrative medicine. What we are going to introduce with this is integrative medical yoga therapy. As an Indian, it's an indigenous gift for an Indian to know about yoga and yogic lifestyle since from the childhood. Now we are talking about yoga as a therapy. Being a yoga student, you might have studied many sorts of different styles of yoga practices. You can name it. There are n number of yoga practices you might have studied. Iyengar yoga, Ashtanga yoga, hot yoga, Bikram yoga, power yoga, Vinyasa yoga, Vini yoga. So many things you have studied. But this concept of yoga therapy applies to any forms of yoga practices which you might have done before, because this concept is static and also dynamic. Why I say both static and dynamic? Because static means the disease part and the patient part is static. This we cannot change as such now, but dynamism in this is we can modulate yoga practices in the form of asanas, meditations, pranayamas, kriyas and few other yogic counseling or spiritual counselings in such a way that which can adopt this particular disease and this particular personality. So this yoga therapy is both a static and also dynamic way of treatment. But it needs you to know about the disease first. I sincerely request all the yoga teachers not to try anything on your patients unless you know about your patients, unless you know about the disease which patient is suffering from. So don't give any form of treatments or yoga if you don't know what disease that patient is suffering from. Say for example, there is one case in my hospital coming with disc prolapse. So there was a disc prolapse. An example, the vertebral disc from L3, L4 and L5, it has been herniated just because one of the yoga teacher taught frog jump in a patient already suffering from mild disc prolapse. It became severe disc prolapse. So yoga teacher might have given with a good intention, but that intention is not served here now. It stopped. So I request all the yoga teachers, only when you know about your patient or your client as a patient, when you know about that particular client and his or her disease, then only treat. So kindly don't bring disgrace to whatever yoga form which you are doing. It's a kind request to all the yoga students of all the communities of all the forms of yoga throughout the world is don't bring any disgrace to whatever yoga form you are doing by harming your client or patients, by your misunderstanding or your inability to understand that particular patient or that particular person. So what I request you is know about your client or patients and his disease beforehand. Just drawing a small picture of a person sitting in a meditative pose. According to concept of yoga therapy, in one of the yogic script or a book by name Yoga Vashishta, there is the explanation of 5 different bodies which are existing in conglomeration without a watertight compartment in a human being. Those are, as I already mentioned there, gross physical body, vital body, emotional body, intellectual body, and bliss body. So just to represent one layer is bigger than another layer, I have drawn like this. Usually I can also draw like this. Outer compartment as a physical body, inside the physical body, vital body, inside the vital body is emotional body, inside the emotional body is intellectual body, and inside is the bliss layer. I can represent like this based on their expansibility or their worth of being larger than just physical body. I can represent like this, or I can also represent like this, outside in or inside out. So this is physical body. You can pause for 1 minute. As I described, the sheets or kosha, in Sanskrit it is called as koshas or layers or body. So one thing we can notice is this is not a very watertight compartment where I can differentiate physical body from energy. So gross physical body, what physical body you are having is that gross physical body, and the vital energy in it where it's making you breathe, which making you think, which making you see, which making you digest your food, and which is making you all the processes of your body automatically and intelligently. That is your vital body. With physical body and vital body, you have emotions, good, bad, positive, negative, all sorts of emotions, emotional complexities we have in our existence. So that is also we consider as a body. And very interesting fact is, modern medical science describes mind-body medicine. They say disease starts from your emotional being. And Yoga Vashishta, many years before, maybe more than 3000 years before, has described as a Manomaya Kosha is a causation of a Vyadhi. Vyadhi means disease. So this fascinates me or few group of doctors that how come modern medicine and mind body medicine has been already talked in many years before in the form of Vyadhi or a disease which starts from Manomaya Kosha. So this fascinates us to go deeper into this form of research, and it is true that usually disease starts from emotional body or Manomaya Kosha. We say this form of diseases like psychosomatic diseases. Actually, this is an old term to describe mind body diseases. Psyche means mind, soma means body. So, diseases related with mind and body. I'll give a small example of worry, hurry, and hot curry, causing increased hydrochloric acid in your stomach and causing ulcer. So ulcer is a physical part. Your worry is a emotional part. So with your worries, there is increase in hydrochloric acid secretion from your stomach by internal stimulation of another hormone called as gastrin. Worry increases gastrin secretion increases your hydrochloric acid. This hydrochloric acid burns your stomach wall, causing ulcer. So it's a perfect example for disease starting from emotional body and percolating into the physical body. So this is why we say we need to know about mind and its causation of disease. Intellectual body is a fourth sheath or a body of existence where it's mainly based on intellect. So what lecture you are learning now or what I am teaching now is mainly for your intellectual body, because you need to understand what is this concept and then you need to apply. So bliss body, say all people in entire world wants to be happy and avoid of any misery. Is it true for all the people? Yes. Everybody wants to be happy and nobody wants any pain. So there is a beautiful Sanskrit saying, Sukha Prapti and Dukkha Nivritti. Just what is the motive of everybody's life? They explain in a very simple, beautiful 2 sentences. Is Sukha. Sukha means happiness. Prapti means gaining. I want happiness. Dukkha. Dukkha means pain or troubles which you have. Nivritti. Nivritti means I don't want. I want to disconnect from unhappiness and I want to get connected from happiness. Or I want happiness and I want to avoid misery. I want to avoid pains. I want to avoid all the problems. It's very simple motive of life. So at an intellectual level, we need to know what we are discussing and then we can apply. So bliss body is a happiness body which is there within. So whenever we feel happy, we tend to go inwards and enjoy the happiness. Now, very interesting fact now is how we are integrating this integrated medicines, mind body medicines and yoga therapy into one form. I'll just explain. You can pause for a while. So this is the concept of yoga therapy. Now I integrate the mind body medicine part and integrated medicine part and yoga part, and we'll say how we are working. Say at a gross physical body, what best we can give for that particular person or a patient is medicines, or surgery if required, diet modification you can give for gross physical body, exercise, kriyas you can give. So at a gross physical body, I am including exercises, diet modification, yogic kriyas, shat kriyas, and medicines. And for the vital body, energy body, I am prescribing pranayamas. Prana means vitality or vital energy. Ayama means regulate that vital energy. So only autonomic or involuntary system which we can control for very few seconds is our breath. So that's why scripture says breath is a mahaprana. We leave our breath when we die, they say, because it's so very important. And pranayamas are important because it regulates your entire vital energy by the key of your breath. So heartbeat we cannot control, our digestion we cannot control, our thoughts we cannot control, but respiration is the one thing which we can control at least for a few seconds, maybe 30 to 40 seconds voluntarily. So that 30 to 40 seconds is combined in the form of different regulations of breath, we call it as a pranayama. And few other techniques like anything which increases your vital energy. Acupuncture.
He's coming. He's coming. Hey.
Acupuncture, acupressure, tai chi, qigong, anything which increases your vital energy is combined with this particular disease, with this particular therapy part. Okay. For emotional body, what we can give is counseling, letting go. Few people, you'll be surprised to say that, or you'll be surprised to listen that kirtans, bhajans, or some musics will connect you to a certain frequencies of sounds which either heal you or it will make your emotions come out. So usually we keep our emotions inside, hidden in our heart, which we don't let it out, which may in turn cause anxieties or depressions or some other forms of diseases. So counseling and letting go phenomena and few bhajans and kirtans are incorporated in such a way that it will help that particular person to work on himself at all the integrated levels, as we discussed. For intellectual body, let's say understanding of the disease, patient education, and few other things are included. So intellectual body is mainly that when I know about the disease as a patient, I can treat myself far better, or I can work on myself better along with medicines, diet and exercises. So bliss body, we are offering something to the patients. We better say, rather than patient, we say participant, the participant who is involved with his health care. Any form of incorporation of treatment in the form of something which makes that particular patient happy is also a form of treatment where patient or a participant feel relaxed at that particular moment. So in this we can include group activities, happy assembly, or healthy interactions like laughter therapy and few other things. Why? Because as I already said, a person is a very complex in his mind, body and emotions, and he'll most of the time in a day-to-day modern day lifestyle, the person will be reserved to himself and just his work. he'll not have time to communicate his emotions or her emotions to other persons who is a neutral person who can listen. So by giving a platform where the patient or the participant who is coming for his or her therapy will get interaction with other people who are suffering from similar diseases, he'll get to know about other person's insight about the disease and how he is managing, how he is regulating that particular disease with all the possible medicines, diet and exercises, and will get that insight, and he'll feel happy that okay, I'm meeting someone who is similar to me, and I feel confident that I can work on myself. So that confidence itself will increase the healing power from within. So this is a very small introduction of yoga as a form of therapy. So I'll give a small example of somebody emotionally upset. Okay. Say for example, somebody scolded you today. So how do you feel? I feel hurt, I feel disrespected, I feel demotivated, or I feel my self-esteem is being hurt. So it creates a series of reactions in your body. So your number of thoughts will increase. Your stress, because it's a stressor. Somebody who is scolding you is a stressor, and he is inducing stress reaction in your body, and that stress in turn increases your stress hormones, which may simply cause you sleeplessness, loss of appetite, constipation on that day, headache, and uncomfortable feeling. So this chain of reaction is there already. And if it is a short-lived, say for example 1 day, 2 days, 3 days, forget all the things, body will recover back to normal. If it goes for many days, the first system of your body affected is stomach, gastrointestinal system. So you may tend to have either vomiting, loose motions, or constipation, or acidity, hyperacidity symptoms, because gastrointestinal system or a alimentary canal is the one which is extremely sensitive for emotional changes, and it will be the first set of organs or group of organs will get affected by them. So this is in general about that. And how we are going to treat this? I advise them a small let go phenomena, or forgive. I want to cut down the series of thoughts at some point. Either this point which is already happened, I cannot stop this. This incident which made you upset is already happened. So number of thoughts, you can do something in a way that which enhances your vitality or enhances your energy and reduces that disturbing energy in you. So what best you can do is let go. Your self-esteem is being hurt, okay, fine. Don't hurt your self-esteem repeatedly by your own self. The one person has hurt your self-esteem, that's one time incident, already happened. But by making you remember every time, you are repeating that process of upsetting by your own thoughts, and you are hurting yourself, you are hurting your self-esteem. So what you should do is just let go. Take it in the form of challenge. So I am modifying this worrying phenomena into a challenge, wherein the challenge will become a positive stress. Worry will become negative stress, which will affect your body and mind. Positive stress, eustress, we call it as eustress. The worrying part is called as distress. Few other examples of eustress is, you got a job, or you got a job promotions, or you are getting married, or you have a children. You are having a child, you are going to become mother or father. So that is again, it's a stress, but this stress is not going to affect your body and mind in any way. You are doing skydiving, so that is a huge stress because people want to do that. You are into a roller coaster ride. It's a positive stress. People want those kind of stimulus or stresses for them to get active and stimulate themselves to work on themselves and move on in life. So you can convert this particular thought process either into eustress or a positive stress in the form of challenge, and take that form of challenge and achieve what you need to achieve with multifold capacity which you already have within yourself. Otherwise distress can make you still more down. Okay, this is a very simple concept. You can pause. Pause.